absolute values or red cell indices. No, see? Yeah. This is based on these absolute values or red cell indices. Clinically, this is very much applied. You will see this will be very easy to diagnose different types of anemia if you understand these terms. So, this will be repeatedly used in your medicine and pediatrics and hematology everywhere. So, you must be very clear about these words, these terms. These are not from your book, this is just very simple things for your easy understanding. You know the red cell shape is biconcave. Biconcave means this is broader at the peripheral area, thin in the center. So, in this broader area, we can imagine there will be more hemoglobin. Hemoglobin is present in the red cell. Thin area, less hemoglobin. When we stain these slides, I'll make the paper clear, stain it. This hemoglobin is taking the eugenic stain, reddish in color. So this peripheral area, which is broader, with containing more hemoglobin, will be more red as compared to the central area, which is thin, containing less hemoglobin, so this will be less red. So this less red area in the center, this is known as central area of pallor or whitish area. This is normal. Central area of pallor, pale, P-A-L-E. Pale means akhzar, yellowish in color. Less red, you can simply speaking, this is less red in color, or in slide this will appear like whitish area. Now normally this is less than 1/3 of the total volume of red cells. Okay, you come here. No, maybe I will talk this loud. Okay, this is red cells, biconcave in, now you listen me, biconcave in shape. That means this is broader in the peripheral area, thin in the center. So when we stain these cells, we will prepare a sphere on the slide, we stain it routinely. This you will be doing in next practical inshallah. After this stain, Leishman stain, these are routine stains, the red cells are now the red cells are like this. Now this is after staining, normal red cells. Central area of pallor or whitish, this means this contains less hemoglobin. Clear? Yes. If this is less than 1/3 of the total volume of the red cell, we consider this normal. Maybe in some of the cells there is no central area of pallor, no whitish area, all is full of hemoglobin. Still we consider this as normal. But if this is increased, whitish area is increased, the cell appears empty in the center like this. This we call hypochromia. Hypochromia, less hemoglobin. Hemoglobin is less in individual cells. So this is normal size with normal hemoglobin. We call this normocytic, and normochromic. Normocytic means normal size of the red cell. Normochromic means normal hemoglobin in individual cells. Clear? Yes. one possibility. Picture may be like this, normocytic, normochromic. Hypo, not hyper. Hyper is overflow. But we don't use this term routinely. This is normocytic, normochromic. Second possibility may be like this. Cell size is small and empty in the center. We call this hypochromic microcytic picture. This you can say hypochromic microcytic or microcytic hypochromic, same. Any word you can use first, doesn't matter. Now, microcytic means smaller in size. Hypochromic means less hemoglobin. Clear? If cells are like this, different causes of anemia. If cells are like this, different causes of anemia, different groups. You will consider on these lines. If cells are larger, we call this macrocytic. Macro or macrocytic, larger size. But we usually don't use this hyperchromia, this term. This is macrocytic anemia or macrocytic cells.
You said it's normal, it is full of hemoglobin.
Now see these three pictures. Now see this, you can see this. This is normocytic, normochromic, normal cell size and normal hemoglobin in individual cells. Now, this is not going forward, not very good. Anybody to help me? This is not changing. Next slide.
اضغط على الشاشة نفسها.
Yes, Shabbat. Next. Now this is microcytic hypochromic. Cells are small in size and empty at the center with less hemoglobin. Now if picture is like this, now these are the causes. Iron deficiency, maybe number 1, number 2, number 3, number 4 iron, then thalassemia, minor lead cause, anemia, chronic disorder, sideroblastic. You will click on it. Most common cause is iron deficiency. If you write this iron deficiency on number 5, although in line, here all are correct, but again this is wrong. If you diagnose a patient with a microcytic hypochromic picture and you think, oh, this possibly this is sideroblastic anemia, only maybe 0.5% chances you are correct, because this is very rare. Maybe 80%, 90% chance iron deficiency. 90% cases will be from iron deficiency. So, yes, please remember this. If you will diagnose rare diseases, you will be rarely correct. Understand?
Yes.
So just go for common things. Most of the things, these are, if picture is like this, what you will think in number 1? Iron deficiency. But there may be other possibilities, especially in here, in Pakistan, in South, this thalassemia minor. You have to differentiate this. You will learn in your theory. This is inherited disease. Picture is very much resembling. Treatment is very totally opposite. So, in this sense, this is very important to rule out this disease, because here patient only needs iron deficiency anemia. Thalassemia, iron overload is the major cause of death in this patient. So opposite, if you are giving iron to this thalassemic patient, this means you are trying to kill him, not treating him. So this, in such conditions, maybe only 5% chance, but you have to rule out this possibility, because this may be very harmful. So these are the causes for microcytic. Now you understand this? What will be microcytic? Hypochromic picture. Small in size with less hemoglobin. Normocytic, normochromic means normal in size with normal hemoglobin. Third possibility, macrocytic, normochromic. Now you can see if these are normal cells, now these are larger than this, many cells, larger, and this hemoglobin, full of hemoglobin, macrocytic and normochromic. Larger in size, what?
Normal hemoglobin.
Yes, Shiva.
Yes.
See this. The patient has this type of cell. These are larger and full of hemoglobin, but still there is anemia. First tell me the definition of anemia. Okay. What is anemia?
Less of RBCs.
Less number of RBCs.
Less generation of RBCs.
Less generation of RBCs. Yes, any other?
Abnormal RBCs.
Abnormal, yes.
The number of the
Function is abnormal, yes. Yes? Yes, yes. Yes? You were close to the correct sentence.
Less hemoglobin also.
Yes, Shiva, please remember this. By definition, anemia means less hemoglobin. Hemoglobin is below the lower limit of normal for that age and sex of the patient. You have to consider these two things also. Age of the patient, because this is different for different age groups. Normal range is different. And sex of the patient.
This is normal hemoglobin or high.
This is normal. Normal. You can see central area of pallor is there, or maybe less than 1/3, so this is normal. Individual cells, the hemoglobin is within normal range, but their size is larger. So we call this macrocytic, normochromic. Now I am talking about this thing. Red cells are even larger than normal, full of hemoglobin. Why patient is anemic?
No hemoglobin.
Less?
Hemoglobin.
Of course, less hemoglobin. This is anemia.
Yes.
Anemia means less hemoglobin. But hemoglobin is present in the red cells. Cells are full of hemoglobin.
Dysfunctional.
What?
Less RBC.
Yes, less number of RBCs. This is the reason in such cases.
Or this structure.
Yes, Shiva. Normally, in most of the cases, when hemoglobin is low, RBC count, packed cell volume, PCB, you have done in your physiology, both will be low. All these three values will run in parallel. Imam comes late. When the salam is ready, then he will open the door. Yes. Here, red cells are full of hemoglobin, even are larger in size, but still patient is anemic because red cell count is low. Clear? In most of the cases in anemia, all these three things are parallel. Three values. Hemoglobin, when hemoglobin is low, red cell count and packed cell volume or hematocrit, this is same. All three will be low, but not everywhere. Remember this please. This may be a diagnostic point. In thalassemia minor, you will see in this, if you, for example, you get this report in hematology analyzer, we feed this sample, this will give us maybe within 2 minutes all these results. RBC count, white cell count, differential count, MCV, MCS, MCSC, platelet count, all these are there. Now, RBC count, what is the normal range for RBC count? Just find your sheet, 4.5 to 6, just maybe small difference in different books, 4.5 to 6.5 million per microliter in an adult male.
اللي بالأخضر.
We take it, roughly speaking, 5 million per microliter. This is within normal range. So, count maybe 6 million, 6.5 million upper normal, or sometimes even above normal. Still, hemoglobin is low, patient is anemic. This is typical finding in thalassemia minor. Understand? So, anemia is low hemoglobin, not low RBC count.
Yes.
RBC count may be normal or even above normal.
Yes.
In some cases of anemia, not in all.
Yes.
Understand?
Yes. Yes.
Remember this?
Yes.
Now, these are the terms used for these different types of anemia, and these are based on these absolute values. We consider three things: MCV, mean cell volume; MCH, mean cell hemoglobin; MCHC, mean cell hemoglobin concentration. These three values, these are known as absolute values or red cell indices. On the basis of this, we will get in routine. If we know three values, hemoglobin, RBC count and packed cell volume, then this is just mathematical calculation. We can calculate, we can do these three tests manually, then calculate it. Or by this hematology analyzer, all these will be there. But you should be able to interpret the results. You should know what is the meaning of this and what is the benefit of this, clinical application, why we are discussing. Now, I have shown you this slide. I will show you again. Normocytic, normochromic picture, patient is anemic. Different list of causes. What may be the causes of anemia? Macrocytic, anemia, different group of causes. Microcytic, hypochromic, different group of causes. Then you have to do differential diagnosis between these causes, not the other. Now, how we what is this MCV? See this. MCV, mean cell volume, average volume of individual red cell, औसत volume. So, what is this average? Total of anything divided by total number. Clear? So, here consider we have 1 liter of anticoagulated blood. In place of small capillary, in your physiology what you did, PCV, we have 1 liter, full 1 liter. You centrifuge this, all, what will happen? Cells will settle down, upper portion is plasma. For PCV, what is the normal range or hematocrit? For an adult, this may be 42 to 52%, for example, for an adult male. This we can write 0.42 to 0.52 liter per liter. If we give the percentage, this is hematocrit. You check it with the scale what you did in your physiology. This is actually hematocrit. The same if we give liter per liter. This means how much out of 1 liter? Total volume of blood is 1 liter. If we centrifuge all this blood, out of this blood, the red cells will occupy this much volume. 0.42 to 0.52. Just for your easy understanding, we take it as 0.5. 0.5 liter. This means, normally this is like this. Half is plasma, half red cells. White cells, platelets, in normal person, they are just negligible. We can ignore them when we are considering the volume. Understand? When you will centrifuge, lower portion will be with red cells. No, this is not serum, this is anticoagulated blood, Shava. You should be clear about the difference. In serum, some coagulation factors are consumed, utilized. Then this fluid portion comes up. This is not same like plasma. In plasma, everything is same. We add some anticoagulant that will not allow to clot anything. Then we centrifuge. Or even you leave the sample in test tube and like this, red cell will settle down, plasma will come up. Maybe this will take 24 hours, something like this. You can see this. I can show you these tubes from previous thing. Maybe. Plasma is on the top, lower portion is red cell. Centrifugation means we force the plasma to come up. Cells are heavier, they will settle down. Cells will be very close to each other. This is packing. Packed cell volume means when these red cells are just like this, nothing in between, attached to each other. All cells are down. All plasma is fog. So this is packed cell volume. Clear? So out of 1 liter, very simply speaking, nus liter will be plasma, nus liter red cells. Clear?
Yes.
So we take it 0.5 liter. This is the normal range. This is the volume of total red cells present in 1 liter of blood. Clear? Nus liter out of 1 liter. This is the volume of red cell. If we divide this total volume by total number of red cells present in 1 liter, this will be volume of 1 cell.
Mean cell volume.
You have to go to the Tosada again. Oh, for example, there are 20 students. You, mashallah, understand in terms of riyal easily. I have 200 riyals to distribute among these students. Total money 200. Total students 20. How much for one student?
10.
So total money divided by total number. This will be average for one student. Clear?
Yes, yes, clear.
So this is same here. Total volume of red cells in 1 liter of blood divided by total number of red cells present in same volume or same 1 liter of blood.
1 liter of blood.
Understand?
How about this?
This 0.5 because nus is plasma. First we are considering blood. In this blood, half is plasma, half red cells. Okay? So, this will be total volume of red cells in 1 liter of blood. Clear? In a normal person. If we divide this total volume by total number of red cells present in this 1 liter, this will be volume of 1 cell. This is normal range for red cells. We are taking in between 5 million per microliter, this much, or 5 multiplied by 10 over 6 plus multiplied by 10 over 6 means this is for 1 liter because this much 1 million microliters are present in 1 liter. If we will increase the volume from microliter to 1 liter, so this will be multiplied by the same figure. This is 10 raised to the power 6.
6.
Clear?
Clear.
Yes, Shiva. See this. In your books, you should be very clear about these things. This is given. This is international standard. For example, hemoglobin. What is the normal range of hemoglobin? Physiology is finished. Hemoglobin, normal range.
14 or 12?
Okay, say something close to this.
12 or 14?
Okay, 13 to 17 or 13.5 to 17.5 gram per deciliter. Clear? Same we can write in place of 13, this will be 130 to 170 per liter. Before we were taking in deciliter, this is 1/10 of a liter. Understand? If we need the value in 1 liter, this will be 10 times than this value.
تحويل
Because
وحدات
10
يعني.
deciliter present in 1 liter.
Yes, yes.
Understand?
Yes.
So both values are given in your books. You should know this.
Yes.
Similarly here, red cell count, this is in 1 microliter, this is in 1 liter. Both are given in your books. You should be able to interpret these things. Clear? This volume, 1 liter, is increased by this figure. 1 million microliters are present in 1 liter. Clear? Now we are taking this average of this 5 million in microliter, or 5 multiplied by 10 of 12 per liter. Now if you calculate this, this is MCV here. Now see this. This will be, MCV will be equal to 0.5. This is the total volume.
على
Total volume of red cells in 1 liter of blood.
نص لتر.
This is
حطها مكان
total number.
10 6
Clear?
6 زائد 12 صح.
Now I want to omit this point. This will be
بس 11
هي 10 10 13
clear. This is same.
ضرب
To finish this point, I divided this one. Clear? So this is equal to, this is finished by this
13
1 over,
يصير 10 أس 13.
this is clear?
Yes.
Now
الخمسة تروح مع الخمسة.
this is difficult to understand. What does this mean? We give this in femtol, some understandable amount. So if I multiply this, for example, 100 over 100 means 1.
1 yes.
So this will be 100 divided by 10 raised to the power 15.
Yes.
Yes.
This is same.
Same.
So what is this? Femto.
فهمتوا؟
Femto?
اسم الوحدة اسم الوحدة.
فهمت يونس؟
Femto. What is this? 1 divided by 10 or 3 milli. Maybe milligram, milliliter, anything. This is
Yes.
1 divided by 10 or 6 micro.
مايكرو.
By 9
نانو.
nano. 12
Pico.
pico or micro.
هذه فهمتوا.
10 is 15.
فهمت.
Femto or femto?
فهمتوا.
Femtoliter. Clear? Now this is 100 femtoliter. Clear?
Clear.
I can finish this? This you understand now? Yeah, Shabab, see this. This is normal range. Now I am coming to the proper thing, application of this knowledge. This is all only for your understanding. See this. This is normal range, 86 plus minus 10 femtoliter, or 76 to 96 femtoliter. This is normal range of MCV, mean cell volume. Average volume of red cell will be within this range. If this is normocytic, within this range we will call them normocytic, normal in size. Clear? Now if this is below 76, what will happen to the size of the red cell? Sabar, yeah, share. Normal MCV
Normal.
76 to 96. Sabar. I will ask, then only that person will answer. I want to involve everybody. I can see your faces, who is here, who is not here. Yes, before 76, this MCV for one person, one patient, this is 60 femtoliter. What does this mean? Yes? Yes. Yes, last. No, you. Stand up. What is your name? Ahmad? Last name? Last family name? Abdullah? Okay. MCV below 70. MCV is 60 femtoliter. What will happen to the cell? That cell will be smaller in size. 76 to 96 is normal. Below this, smaller in size, microcytic. Above 96, macrocytic. Clear? Similarly, now this is hemoglobin. Not take your seat. No, this is hemoglobin. Shabab. MCH means cell hemoglobin. Normal 13 to 17 gram per deciliter in A, and another male. We take it 15 gram. Just for easy calculation. Yes? 15 gram per deciliter is absolutely normal.
15 gram.
15 gram per deciliter. This will be 150 gram per liter. Clear?
Yes, it's clear.
1 deciliter is 1/10 of 1 liter. 10 deciliter is 1 liter. Clear? So 150 total hemoglobin present in 1 liter of blood. If we divide this hemoglobin to total number of red cells, this is total number of red cells in 1 liter. So this will be average hemoglobin in one cell, mean cell hemoglobin. Clear? So, yes?
Again,
This is total hemoglobin
total hemoglobin.
present in 1 liter of blood. Oh, mister. Here. Total hemoglobin in 1 liter of blood. This is total number of red cells in 1 liter of blood. If we divide this hemoglobin by this number,
Hemoglobin in one.
this will be hemoglobin in one cell. Clear? So now this is normal range 27 to 32 picograms. Now just finish this. I calculate this. Here this will be 30 picograms. If you calculate this, 30 divided by 10 is raised to the power 12. So this means 30 picograms. So this is normal range, 27 to 32. So what will happen to the cell if this is below 27?
Hypochromic.
Hypochromic cell.
Yes.
Clear? Central area of pallor will be increased like this. If I say the MCV is 60 femtoliter and MCH is 20 picogram.
Microcytic hypochromic.
Yes, picture will be like this. Picture will be like this. Microcytic, hypochromic. Most of the cells are smaller in size, empty in the center. Clear? If For example, MCV is 85 femtoliter, 85, and MCH is 30 picogram.
Normocytic,
Normocytic, normochromic. Picture will be like this.
Yes.
Normal in size. Most of the cells will be normal size with normal hemoglobin. Okay? If you see in this report from hematology analyzer, MCV is 120 femtoliter. 120 femtoliter. Upper normal is 96. This is very high.
Macrocytic.
Macro.
This will be macrocytic. Cells will be like this. Clear? Now when cells are like this, these are the causes. Clear? You will think on these lines for these diseases. When MCV, MCH, third thing is MCHC, concentration. That is similar like MCHC. We calculate this by total hemoglobin divided by total volume. This is total hemoglobin 150.
I must do again.
Like this.
First do this and then
All these are given in your routine CBC. Understand? This is just mathematical. You should know what is the meaning of this. For hypochromic cell, MCH will be low, MCHC will be low.
Microcytic,
Hypochromic.
no.
For smaller size, MCV will be low. Larger size, MCV will be high. Clear? Now these are the causes. You will learn in your theory, then you will inshallah memorize these things more clearly. These are main three types of anemia on the basis of morphology. Morphology means shape of the cell. Clear?
What is the MCHC?
concentration.
One thing is absolute. This we are measuring the weight of hemoglobin in individual cell. Here we are measuring the concentration of hemoglobin. Hemoglobin, we measure hemoglobin in grams, but in some volume. For example, we are talking about hemoglobin here. This hemoglobin is in 1 liter of blood.
1 liter of blood.
15 gram per deciliter. Understand? So we consider the weight out of some specific volume. This is concentration. Similarly here, this is total hemoglobin in 1 liter. This is total volume of red cells in 1 liter. So total hemoglobin by total divided by total volume, this will be concentration of hemoglobin in individual red cells. Clear?
Yes.
This MCH is low, MCHC will be also low. This should be clear. But you should know these terms, three things mainly. What is microcytic hypochromic picture? What is normocytic normochromic picture? What is macrocytic picture? Clear?
Why normocytic normochromic anemia?
We discussed-
All normal.
Yes, we discussed this again. Even in macrocytic, cell size is larger. Even more astonishing than this, cell size is larger, full of hemoglobin. But still patient is anemic because red cell count is low.
Yes, but they're normal. That's the
Normocytic, same problem. Red cell count is low. Understand? I gave this example. If there are 20 students, yeah, Shiva, we have 200 real, 20 students. How much per one student? 10 real. Every student in his pocket, 10 real. Only 10 come to the class, 10 are absent. What is the total amount now?
100.
100. So this is below normal. Normal was 200. This is below normal. So you same here. In place of 5 million, red cells are 2.5 million. Although individually they have normal hemoglobin. Clear? Total hemoglobin is less. Half. This is anemia. Anemia is low hemoglobin. Not low RBC, not low PC, other thing. Clear? Now these are absolute values. This is application of the absolute values. Now you can ask any question related to this topic. Yes. Any confusion? Clear? Yes, Shabab. I've taken the attendance. If anybody is late, you can give me your name. Now you have time. If anybody, this is optional, not compulsory. Just for your training. If you want to take the sample, everything is there.
Yeah, thank you.